Hello, this is Stephanie Ellis, your Executive Director of Behavioral Health, Crisis Intervention, and Student Safety for Rockingham County Schools. I wanted to share with you some information about our Behavioral Health District Integrated Response Teams within our district. And I wanted to be able to share this with you through a virtual way so that you could watch this on your own time when it's best for you to be able to get this information, but then also to really talk about our efforts to really work strategically on building social emotional learning skills for our students and our behavioral health services and full continuum of mental health supports within Rockingham County Schools. We have asked that you watch this webinar prior to September 27th because on September 27th, we're having all of our specialized instructional supports personnel come to our behavioral health professional learning community in service and PLC that day at Rockingham County Middle School. And so we wanted administrators to be able to watch this information ahead of time so that you have some of the information that we'll be sharing on that day with our specialized instructional support personnel. So I thank you for your time, and I appreciate all of what you do, each and every one of you, for what you do for our students each and every day. I'm happy to announce and to talk about our behavioral health team within Rockingham County Schools. You guys know me, I'm Stephanie Ellis, and Dee Moyer is our student and family health education and engagement coordinator, and so she works with us on our team in a lot of ways around the substance abuse area and also family engagement and overall wellness. Serena Hooker, which is on the bottom left, she is our day treatment director for our school district. The remaining individuals, Paula Horn, Stephanie Moore, Antoine Fogel, Jay Sladen, and Janet Wynn, are all our behavioral health specialists with our district, and we'll talk more about their role and how they're supporting our schools, each and every one of your schools, in just a few minutes. So I look forward to being able to share this information with you. Just as a matter of information and a reminder, on September 27th, all specialized instructional support personnel need to attend the September 27th Behavioral Health PLC. And that means school counselors, school psychologists, school social workers, school nurse, behavioral health specialist. And we're going to have that at the RCMS cafeteria on September 27th from 1 to 4 p.m. As administrators, if you have an open time, you're more than welcome to come to this training. We love to have you if you would like to spend some additional time talking about some of this information. And obviously we'll share information from this PowerPoint and this presentation, but we'll do that in a more in-depth way on September 27th. However, I know a lot of you have a lot of trainings and things that you're doing on September 27th, so that's why I wanted to be able to provide this information to you in this way so that you could have a good condensed version of this information prior to September 27th. We've talked about this at some of our administrator meetings, but this does provide a more comprehensive overview to be able to ensure that you have the information you need moving forward to prepare for your district integrated response team at your school. On that day, on September 27th, we plan to talk about our vision about comprehensive mental health services and building a full continuum of mental health services and social emotional learning skills within our district. And we're really going to spend a lot of time talking about going from a reactionary mode to a mode of prevention, and how we really need to be able to engage in that prevention mindset and aspect to build resilience for our kids. The other things that we're going to talk about is really our historical organization of how we got to the place that we did to be able to obtain the grant that we've obtained to ensure to build the continuum of mental health services within our district. And then we're also going to talk about those Project Activate goals and objectives that we plan to implement to build that full continuum of mental health services. And then we'll also spend some time talking about behavioral health specialists and their service definition for each school and their major roles and responsibilities. And then we'll also be reviewing our behavioral health district integrated response team purpose. Why we're implementing these teams, how they're different than what we've done before, what should occur at these meetings, what should occur at the meetings, and then who should be in attendance, what happens in the meetings, and what are the responsibilities of each team member, and how does this connect with the work that we're currently doing. And then also we'll review how to access behavioral health support within the district. In the state of North Carolina, a couple years back, the North Carolina School Mental Health Initiative began, and that's a state level team with many different stakeholders from all different perspectives of mental health within the State Department met. And there are regions that are connected to that state level team. And so I was invited to participate and be part of this state level team, and then also our regional Piedmont Triad network. And then through that, we definitely began getting connected to resources and supports to really begin thinking about building a mental health continuum within Rockingham County Schools and what infrastructures were needed to be able to do that. In August of 2017, we began meeting in Rockingham County Schools our mental health advisory team. And this team was really formulated to build a good resource of stakeholders throughout our district and folks within and outside of the district. And then also we started talking about memorandums of understandings and agreements with some of our local mental health partners. And then also really talking about what would this look like to build a full continuum of mental health services and how this would look. And so we've been meeting since August 2017 and working on our strategic plan, our goals, and a lot of the work that we've been trying to do to put some of those infrastructures in place. And then we also developed our mission for that team as well as our strategic plan. And that mission it's the mission of the RCS Mental Health Advisory Council through a collaborative and comprehensive approach between Rockingham County Schools and community mental health providers to ensure access to a full continuum of high quality and well coordinated mental health services for our students. And so that is our mission and our goal throughout our district. We also had the opportunity in 2007-18 that Rockingham was selected as one of the SHAPE pilots. And the SHAPE pilot is the Student Health Assessment Performance Evaluation System. And really what that system is for was to really get a good baseline of where we were with implementation for mental health services. And it also was a database that has lots of resources that our mental health advisory used to begin exploring the work of what this would look like in our school district. And so we were part of that SHAPE pilot and have been able to provide supports to other districts in our state through that work as well. So because of our work with our mental health advisory and also our work with our SHAPE pilot, Rockingham County Schools really was able to be known for a district that really was building our mental health supports, and we were scaling those up in a really unique way through a lot of the exploration and initial implementation activities. And so through that, the State Department actually was applying for a SAMHSA grant, and they had to pick 3 school districts to submit an application for this SAMHSA grant. And so we were approached by the State Department, and they asked me if I would supply a lot of information about Rockingham County Schools and what our need was and why we would need to be selected for the SAMHSA grant. And so I worked, really heavily, got a lot of information from our stakeholders and folks from mental health advisory, and put all of that information and submitted it. And we were selected to submit the application along with the state for the SAMHSA grant. So the state then selected it, and so North Carolina did receive the SAMHSA grant, which also meant Rockingham County Schools received this grant. And there were only 3 school districts, that's Rockingham County, Cleveland County Schools, and Beaufort County Schools, who received the SAMHSA Project Aware grant. And so we were so excited and honored to be able to actually be chosen for that grant. And what that grant means is that we were able to, across 5 years, really focus on building a full continuum of mental health services. And that grant was over $500,000 for 2 years, over $2.6 million for our district alone to be able to really scale up mental health services. So what that means is that allows us to have my position as the behavioral health executive director for the district and crisis intervention and student safety, and then also to have our family engagement coordinator, which is Dee Moyer, and our 5 behavioral health specialists. So that is an amazing resource that we've been able to utilize to really scale up our services within the district. We also have wanted to make sure that these connections are connected to our school safety plan for Rockingham County Schools. We have a comprehensive school safety plan, and as you know, we had our school safety summit in August, and we just revamped and updated a lot of our information. But as you can see in our model, there's sort of 3 components: safe learning facilities, school safety, crisis management, and prevention and resilience education. Obviously, safe learning facilities and crisis management are huge components, but as you can see, that foundational perspective is that focus on resilience and prevention is huge. And so that's what we really want, that the whole mental health component is a whole huge foundational approach to a comprehensive mental health plan. The other part of this is our school mental health advisory, our Rockingham County Schools Mental Health Advisory Council really talked about what our framework of support was, and this is what we call our Lighthouse of Hope. And you can see that we wanted all of this to be aligned with multi-tiered system of supports, that we had foundational practices of mental health services, things like good social emotional learning, positive behavior intervention support, consultation, collaboration, problem solving, decision making, inclusive practices, and partnership research-based practices. And so at Tier 1, Tier 2, and Tier 3, those supports increase depending on the intensity and the needs of our students. And then also that we offer specialized services. It's a blessing in our district that we have our day treatment program that we're able to offer. Not every school district has a day treatment program, and so we have a wonderful day treatment program that offers mental health services all throughout the day for our students. And all of this in collaboration with our Rockstar Mental Health Partnerships and our stakeholders that are involved through our Mental Health Advisory Council. And all of this looking to build a full continuum of mental health supports within our district. Why are we doing this? Why are we working on building the mental health continuum of supports? Well, really it's about, we want to be able to increase academic and social competence. We want to have safe, supportive learning environments, and we want to be able to provide high quality, equitable mental health services for every student within our district. And all of that really leads up to being able to just support our students and support their needs and social emotional learning needs that they have to be successful in their environment at school and after school. This is our behavioral health model for our district. You can see, many of you have seen this emblem or this motto or this logo, I guess you could say, on emails that I've sent you, on a lot of information that our behavioral health team is using. And our motto is really inspiring hope, making a difference, every single one. And how are we able to do that? We do that through a focus on whole child, through partnering, through collaborating, through engaging in family and community, problem solving, and this is my favorite one, collectively serving. That really happens through an integrated response of our specialized instructional support personnel. We have amazing specialized instructional support personnel for our school district, but we need a formalized way to really be able to focus on the whole child and to do all of those things that include in our behavioral health model, and to really collectively serve in a way that really provides sustainability of services and builds capacity of those services within our district. So we started working on that strategic plan, and these are really our 4 goals for our grant cycle, but then also really these are 4 goals regardless of a grant that is about building a full continuum of mental health supports within Rockingham County Schools. So our first goal is about improving behavioral and psychological indices of school engagement and decreasing school disciplinary events for pre-K through 12th grade by implementing universal prevention activities within a multi-tiered system of support. And so obviously we're implementing that for academic and behavioral needs, but we also need to implement that for social emotional learning and mental health needs as well, and have a good strong core for social emotional learning and behavioral health. The second goal is about reducing school dropout, rate of attempted suicide, and substance use by increasing the number of at-risk students receiving supplemental and intensive mental health and substance use supports within a multi-tiered system of supports. So this is really about increasing our access to those services for our kids. So being able to make sure that when they need Tier 2 and Tier 3 supports, that those are offered in a highly coordinated way and they're high quality, and that we connect our kids as quickly as possible to those services when they need them. And then goal 3 is about improving the coordination and sustainability of mental health supports and services through increased family and community engagement. And then also goal 4 is increasing the knowledge and effective practice of all school staff in recognizing and responding to student mental health needs. So that really makes up an overview of our behavioral health model within Rockingham County Schools. Our behavioral health specialists that I spoke about, we have been meeting greatly to really talk about their service definition and the support and what that looks like for your school. And so these are new positions to our district, and they have a multifaceted role, and so we're going to spend some time talking about that role. This is the service definition that we have provided for you, and I'm going to read that to you. It's the behavioral health, mental health specialist of Rockingham County Schools will ensure behavioral health services are coordinated to enhance the continuum of mental health and social and emotional learning for students. These services may involve coordination of care, direct services, and consultation with school staff, families, and community agencies in collaboration with specialized instructional support personnel. So that really is the service definition of our behavioral health specialist. So who are the students that are being seen by our behavioral health specialist, and what is their role? Obviously, through the grant, their role is we're going to be engaging in mental health contacts and counseling with our students. So that's a huge component. They each have set number of contacts that they're going to be meeting with students at your school, and each of them have multiple schools, and the goal is that they would come most weeks, one day a week at least, and come to your school and provide that mental health support to your students. But then also, how do we refer students? How do we give access to them? Those referrals are going to come from our Behavioral Health District Integrated Response Team that you have at your school. You received a link in the email that I sent to you in this webinar as a reminder to ensure that you have these once-a-month meetings set up for all specialized instructional support personnel. So these behavioral health specialists are going to help facilitate those meetings at your school, but all of your specialized instructional support personnel need to attend, and we'll talk more about that later. But those referrals for students are going to come out of those meetings and some of the information that you guys are talking about in those meetings so that we can connect our students with these behavioral health specialists. Students that are in need of Tier 3 intensive needs supports or individualized supports are students that may be supported by our behavioral health specialist, and also students that have a completed functional behavioral assessment and behavior intervention plan and or an imminent threat or suicide assessment. Also, our behavioral health specialists will provide supplemental school-based counseling services. So even if they're receiving an outside counseling service, the purpose of their service at your school would be to really help students generalize appropriate behaviors across your school setting, teaching of behaviors, also mental health needs, social emotional learning skills that they need to be successful within a school setting. And really they have a specialized skill to be able to provide this service. So this would be a service that may need to be layered on top of outside counseling support. And these services would be identified through your Behavioral Health District Integrated Response Team at your school. And then our behavioral health specialists really are a partner to our specialized instructional support personnel. So while threat and suicide assessments could be part of that they help support and participate in that team, one of their main goals really is to increase mental health contacts. For us to be able to get on to get away from that reactionary side to the mode of prevention, we have to be able to offer those mental health services to our students, and and really be able to help our students connect what that looks like in full implementation in our schools, and how does that enhance and support the behavioral health services and services that we already provide in our school. So when you think about a behavioral health district integrated response team, we've talked about that a lot so far. That team is made up of a lot of different mental health disciplines. And so when you look at this slide, you see there's the whole school, whole child model, right? That's at the center of all that. But then you have lots of different professions that all really have a best practice model about how to implement their service in their school. So we have, the school counselors, the SROs, the National Association of School Psychologists, the school social workers, CEC, NAMI, our Nurses Association, all of those associations, each of them have their own model for what's considered best practice. So when you take all of that and you put those professions together, each of those professions supports mental health in a different way, and it takes all of those professions, all right? So when we're talking about behavioral health, that really is more of the modern term for mental health, and it incorporates the study of emotions, behaviors, and well-being, and it also even incorporates, just the overall well-being and self-concept of a student, and it really is the preferred term to mental health. So when we're talking about specialized instructional support personnel, that means that means all of those individuals who provide direct education, therapy, counseling, assessment for all children who are experiencing needs that interfere with their learning. So they can provide consultation, professional development, parent education, community language, and program and administration. And so all of those specialized instructional support personnel folks, provide that service to our students. And we need to do that in an integrated response. And so when I'm talking about an integrated response, that means a formalized collaboration where we combine and coordinate separate elements into a harmonious whole. And so this is different than what we've done in the past, in that a lot of times those different professions have all worked extremely hard to support our students. But we need to do that in a more formalized, collaborative way. And all of this being aligned with multi-tiered systems of support. So there's two levels of that team within our district. One is at the district level, which is our behavioral health leadership team, who I introduced to you at the beginning of this training. And then also we connect to all of our other specialized instructional support personnel members too at our various departmental meetings as well. So that happens at the district level. At the school level, these teams happen with specialized instructional support personnel teams, CSIP teams, together in your school. So each of this happening at the school level as well. And so the purpose of our team at the district level and the school level is really that we focus on the whole child. We partner, collaborate, problem solve, collectively serve, and engage our families and our students and our community in this work to improve social, emotional, and behavioral health needs for our students. And so why are we doing these teams? The reason is because we need that integrated response. We need that whole child approach, and we need it aligned with a multi-tiered system of support and utilizing a multidisciplinary approach. We need a feedback loop to our MTSS teams. That's hugely important. I can't stress that enough. But these folks need to collaborate. Our mental health professions that make up specialized instructional support personnel need to be able to collaborate in a formalized way, in a confidential setting, to be able to really connect our students, to make sure that they're getting universal supports for social, emotional, mental health, but also supplemental and individualized supports as well at Tier 2 and Tier 3 levels for MT. So the other reason is that we want to create system level change. We live in this reactionary mode. And I think about it like this. If you think about dominoes and how once they start to slide, they're all lined up and they start cycling and it's like a chain reaction. That's often what happens when we're living in this reactionary mode. And we want to get from that reactionary mode to a prevention mode. We want to increase our opportunities for prevention. And so the way to do that is through a behavioral health district integrated response team, specifically that has specialized individuals in mental health who are talking about all the students within our building to be able to connect them to services and to be able to really truly monitor and follow up with them and ensure that they're receiving and accessing those services. So we've talked about that system level change, but this also brings about school level changes about how we function and how we connect kids to those services, and we ensure that they're receiving those services. And this also means that we're going to spend a lot of time this year talking about each of those CSIP personnel, specialized instructional support personnel, and how they're able to engage in their role and what that means for them supporting each of our students. And then also being coordinated in our crisis response efforts and what that means moving forward in our district and what that looks like in an integrated response for all of our staff. So at the district level, our behavioral health leadership team, we meet at least every 2 weeks. And the purpose of that is to ensure that we have alignment with MTSS. We have a feedback loop on our district level team, obviously, for that. And then also to ensure that we are really problem solving and ensuring that behavioral health services are coordinated in a way that our school teams can ensure that they know what supports are available for their schools as well. And then also we're a feedback loop to our mental health advisory and our connection to our community and mental health partners as well. And so this is a sample of the district level behavioral health agenda and some of the things that we're talking about. Obviously, there are other things that could be on this agenda as well, but we talk about Tier 1, Tier 2, and Tier 3 supports, community partnerships, data collection, behavioral health meeting needs and discussions, and things that our school teams need to support this work. And so that is an agenda that we assign, and it is a problem-solving model kind of agenda. And so we also want to provide services for our PLC and to make sure that we have good professional development for all of our CSIP, specialized instructional support staff. And then provide our support and clarity and roles for the teams, feedback loop for schools and teams, problem solve and remove barriers, advocate, feedback loop to our district cabinet, training needs and scheduling, and discussing agenda items, for various other groups, and also our mental health advisory. We also want to make sure that we have that we maintain a strategic vision for what behavioral health looks like in Rockingham County schools and how we scale up social emotional learning. And then we want to provide training and problem solving guidance. We want to provide professional learning communities and professional development for our school teams, and coaching supports and guidance and best practices, all aligned with multi-tiered system of support. So our behavioral health specialists, while they're that contact and they help run our PLCs along with me and Dee, but also we want them to help streamline district communication and solidify operations and help with behavioral health response. And so that doesn't mean obviously they're the only ones implementing behavioral health, because mental health belongs to all of us. All of us working within a school district have to be able to support behavioral health with our students. Because as you know, if we don't have good behavioral health or good mental health for our students, we really don't have much of anything, right? And so being able to coordinate that in a fashion and being able to have a contact that supports your school team is really important. And so also we always maintain, and we want to make sure that district level communication is happening, and that there are feedback loops to administrative meetings, to collaboration meetings, with our different departments within our district, MTSS teams, our mental health advisory, our SHAC team, administrator meetings, and our district cabinet and core leadership. So just as a reminder, these District Integrated Response Team PLCs are actually going to happen. Our first one is September 27th at RCMS. The next one is October 29th, and then January 17th, and then March 23rd for our 2019-20 school year. And if we need to add more, we will. But these right now are scheduled on our teacher work days that are required work days in our district. And all specialized instructional support staff, all of our CIS, CSIP teammates have to be there, okay? And the purpose this was put on a required teacher work day is because we didn't want to pull all of your CIS staff all at once and during a work day, during a school day, while kids are there, because naturally a crisis of some sort could occur and we didn't want to pull them all at the same time. So we're asking that they preserve and protect this time to be able to attend these training sessions, because they're going to get vital and critical information to support the work and the full continuum at your school. So who's on the team? So this is who our CSIP individuals are: school counselor, school psychologist, behavioral health, mental health specialist, school nurse, school resource officer, possibly could be on the team if that's a need, and school social worker. And obviously we want administrative feedback, and then also, it may be necessary to pull in an exceptional children's teacher depending on the nature and needs of the student, or the SRO if there's a unique situation that you're having with the student and you need to pull those folks in. And the purpose of this is really to talk about social, emotional, mental health needs in a cross-disciplinary way that's aligned with MTSS. So this is what the example agenda looks like. You will get access to this agenda for your behavioral health district integrated response teams. But I wanted to talk through this example agenda. This is the standard format that you guys will use. And so you can certainly add to it, but these are the core components of that agenda that have to be there, okay? So we start out, we have team norms and core values, and there's always a spot for attendance for who's there. And then you can update that date every single time, and keep a running log in your Google Docs to be able to have a place to house your notes and actions and decisions. So that's sort of the front part of the agenda. The next part is really split up. You can see the agenda topic, notes and decisions, and then who is doing what and by when. And so this really is set up in a problem-solving type of way. And that meeting schedule and announcements, we're going to start off with that and talk about any upcoming trainings, PD that we want to attend, announcements, just general things that we want to talk about. So I want to say this. So your specialized instructional support personnel, those folks, many of those roles serve multiple schools. So that might be, as a scheduling, that might be a need for really being able to have that group come together and try to pick optimal times. If you do that in a coordinated way, we're asking that you meet once a month, and that coordination could look like in person, or it could be through a Google Hangout or a conference call or something of that nature, okay? So that could look like various things. However, you do want to talk with your staff and really try to pick optimal times, because if each of these staff members have a certain day that they always come to your school, that might cause for a little bit of scheduling difficulty. So we all kind of have to be flexible and let each other's schools share that person and pick an optimal time for everybody, okay? The other part of that is that you want to talk about how will we ensure participation. It really should be that we make a commitment to protect that time and that we're available for this meeting. Right now, there's no other meeting where all of these staff are at the same place at the same time or committed to protecting that time and participating at least virtually with each other in these discussions, and we need to protect that time. We want to review team norms, make any addition and changes about how we're going to communicate with each other and interact in this meeting. And then you want to set meeting roles and assign roles. Who's going to be the note taker? The behavioral health specialist is going to facilitate the meeting and kind of walk through the agenda, but also who's going to bring the data. Each time you might want to make assignments as to who's bringing the data to the next meeting, and then a timekeeper to kind of keep us on schedule. The plan would be that these meetings would last an hour to an hour and a half, at your school. That would be a reasonable time frame to expect. And then also reviewing suicide and threat assessment data from the previous school year and current school year, reviewing the number of outside counseling referrals from the previous year and the current school year, and then also behavioral health screening data results. That will be coming forward. We haven't selected our screener just yet for Rockingham County Schools, but that will be happening this school year. So that'll be a section that'll be reserved for that when your school begins implementing the screener. Okay, so that's kind of a forthcoming area that will be added on your agenda at that point. And then you're going to talk about Tier 1 core social emotional learning. What are we doing in this area? What are the needs? And we want to make sure that these needs are connected to our 5 core CASEL components for social emotional learning. And, we want to make sure that our kids really are getting access to core social emotional learning supports. And then Tier 2, discuss intervention groups for Tier 2. What kind of counseling groups do we need? Who's connected to check and check out? Who's doing peer mentoring? Any other Tier 2 level supports that we might have within our school? Who's doing that? And what's the progress of those students? Do they still need to continue, or is it time, that they need more intensive needs through supports? And what data will we use to make these determinations? And then Tier 3, you're going to talk about students who've had threat or suicide assessments in the past month. You want to talk about safety and monitoring plans, and who you want to go back and revisit those and make sure that those things are happening within the school, because we certainly don't want to conduct those suicide and threat assessments and then forget about the monitoring plan. So we want to bring those up and make sure that out of our specialized instructional support personnel team, who's checking on which student and what does that look like, and how are the students doing? And then what services might they need, since the last time we talked about them. And then also any students that have intensive behavior needs. As you know, behavior and mental health often overlaps and goes hand in hand. And so we want to talk about those students, and, a functional behavioral assessment should be completed by the school team first, and then that information brought to this district integrated response team at your school, so that you can really look at and say, what is the behavior intervention plan, the behavior intervention plan data saying, and what changes might we need to make? What adjustments do we need to make? And we want to discuss those Tier 3 intervention, the roles of each of the staff at that meeting, and then action steps moving forward to support these students and monitoring activities. And then you always want to set your next meeting and any action steps that you have to get ready for the next meeting. That's also a good place to just put any final reminders and things and information that people are bringing back to the next meeting that's set for the following month. So what does this look like? So it really looks like that we meet monthly. We include all specialized instructional support personnel. We're going to collect, it's going to sound like problem solving, advising, look at referral trends, talk about prevention, increase seat time in the classroom for our kids, review the collective needs of the group, and discuss any outreach or collaborative supports that we need for students. And then also the outcome is that we want to have collective problem solving for Tier 1, Tier 2, and Tier 3 mental health and social emotional learning supports, and that cross-discipline approach to students of the highest need. And we want ongoing communication and updates, and we want to be able to anticipate the trends to support social, emotional, academic success for our students. And so those 3 strategic priorities at the district level and school level for our systems level change with this behavioral health district integrated response team is that we want a unified system to be able to offer seamlessly share data and information. And we also want to align the priorities of all of our specialized instructional support personnel and engage in joint problem solving sessions to support our students. And then also we want to institute formalized collaboration, and that's aligned with MTSS, but then also that we have a common agenda and that we're looking at those areas and ensuring that our students have access to our services and that they're utilizing those services. And then finally, these behavioral health district integrated response teams really also help improve our crisis intervention and our response as well. This year we're going to be talking about developing a hospital reentry plan that we'll be working on at the district level, that we'll also share out with your school teams, and that we also we will be offering a special crisis training for acute trauma events that may occur at your school, like a student passing away or a staff member or something of that nature, where you need the crisis team to come in and support your students in your school. So we're actually going to use a different model, and it's called the NAS Prepare, which is the National Crisis Curriculum written by schools, by people who've worked in schools for people in schools. So it's the only national curriculum that really is completed through a perspective of schools. And so, and then also offering threat and suicide assessment training. We have that coming up very soon. And then also we want to make sure that all of our administrators and specialized instructional support personnel have the appropriate crisis level training and response that's coordinated in a way to improve our behavioral health and social emotional learning for our students. Lastly, I would just say that, please, make sure that all of your administration in your building watch this webinar. This is not going to be shared right now with our specialized instructional support personnel, because they are coming on September 27th for their in-person, face-to-face, more in-depth meeting for behavioral health model within our school system. So we're just asking that administrators watch this video today. And then also I've attached in this email that you receive this webinar in our behavioral health specialist job roles and positions. And then also I'm reattaching the spreadsheet that just asks you to make sure that your team has identified meeting dates for your behavioral health district integrated response school teams as well. And so I just will always say, anytime you guys have a question, you're welcome to call me on my cell phone. You all have that cell phone number. There's my email address. Make sure you send it to slellis@rock.k12.nc.us, and you're welcome to give me a call anytime. And I'm so excited for Rockingham County Schools and all of us, and the supports that we're going to be able to provide for our students. And really the whole purpose of these services really is to inspire hope, make a difference for every single one of our students. And so we want to carry out that mission and that vision by really scaling up our behavioral health and mental health services and social emotional learning supports for each and every one of our students. So thank you for your time today, and I look forward to our continued collaboration support, and thank you for all you do for each and every one of our students. Have a great day.